In this video, I want to talk about a body system that you may never have heard of, but if you've ever had swollen glands because of an upper respiratory system, you have experienced the lymphatic system at work. The lymphatic system is an integral part of three other major body systems. It is supportive of the cardiovascular system in that it returns interstitial fluid to the cardiovascular system and helps maintain your blood volume. It supports the immune system by transporting the immune cells and the various chemicals that are a part of our body's defensive system through key organs and the glands of our body. And it also supports the digestive system in that it is the lymphatic system vessels that absorb digested fats from the small intestine and transport those fats to the venous circulation so it can get around to all of our body cells. This diagram on the right is showing you that the lymphatic system includes both lymphatic vessels, similar to our blood vessels, and certain key organs like the spleen and the thymus, which we've already talked about when we've talked about the endocrine system. So inside your blood vessel, so here we have a capillary. Of course, you have red blood cells, but you also have all of the liquid that the red blood cells float in, and that is known as plasma. So we don't have a place it's labeled here, so I'll just write it down. So plasma is the fluid, basically water with a bunch of important proteins and then dissolved gases and nutrients that the red blood cells are suspended in. When that watery substance is in the bloodstream, it's called plasma, but it does move out. At the capillary level, capillaries are somewhat leaky, and so when that liquidy stuff moves out, it becomes known as interstitial fluid, even though it really is the same stuff, basically water with some proteins and other nutrients dissolved in it. Remember, some of the proteins stay behind in the bloodstream, and that helps pull water back in or pull that interstitial fluid back into the bloodstream. But a lot of it does take up the space in between your cells. You're really very wet inside. Well, that fluid then needs to be collected, or you constantly would be losing blood volume. You'd be not able to maintain the circulation through your cardiovascular system. So that extra fluid is picked up by the lymphatic system. And so the blood, or not the blood, but the watery stuff that we now are calling interstitial fluid gets moved into other tubes, and when that watery stuff is inside these tubes, it is known as lymph. So plasma, interstitial fluid, and lymph are all referring to the same substance in different places in the body. And there's this constant movement of fluid out of your bloodstream, in between your cells, and then into your lymphatic vessels to be carried back to the bloodstream and dumped back in to maintain those plasma levels. So these lymphatic vessels create a pathway that starts with capillaries, and these are capillaries that have a dead end. It is not a circular system where things go around and around, but it just collects lymph from the collects that interstitial fluid, becomes lymph down in the capillary beds on the venous side of the capillary beds, and then travels it throughout your body back to put it back into your bloodstream. The lymphatic vessels are found everywhere except your central nervous system. Like your veins, the vessels of your lymphatic system contain valves that prevent backflow of the lymph as it is moving from the outer extremities of your body back to your torso. And again, like the circulatory system, muscle contractions in your skeletal muscle and the vacuum that's created by breathing, inhaling air in your thoracic cavity also help pull that lymph back towards the heart. Now, on the way, the lymph travels through lymph nodes and nodules, and the function of the lymphatic pathway so far as protecting your body and allowing your immune cells to clean out the lymph happens at those lymph nodes and nodules. And then the cleaned out lymph will re-enter the bloodstream by being dumped into the subclavian veins, which are down below your collarbone. And then those veins, of course, would enter the vena cava and then into the right atrium of the heart to be circulated throughout the rest of the body. The diagram on the left on this page is showing you the circulation where we've got the pulmonary circuit and the systemic circuit for your bloodstream. But then alongside, we have the lymphatic circle with our lymphatic capillaries down in the capillary beds collecting lymph, traveling through lymph nodes on the way back to the venous system, back to eventually the vena cava, and re-entering, putting the lymph back into the bloodstream where it can then take up its role again as plasma. This diagram on the left just kind of has the two systems separate, but in reality, as you see on the right, your lymph capillaries are just entwined in the capillary bed. So as the plasma fluid moves out of the bloodstream and becomes part of the interstitial fluid, those lymphatic vessels are right there ready to pick it up again. And the movement of the fluid is all determined by hydrostatic pressure, which is being driven by the different amounts of protein that are in the fluid in the different places, and that keeps this liquid going from the bloodstream into the lymphatic vessels. Any situation that shuts down a lymphatic vessel because of perhaps injury or surgery, you may have a buildup of the interstitial fluid in the body, and that creates a swelling known as edema. So as the lymph travels through these lymphatic vessels, it is passing through various lymph nodes. And these lymph nodes are serving as filtering centers. They are cleaning up the lymph as it travels through. Lymph nodes are small. They're about the size of kidney beans, and there are many, many, many in your body. And inside the lymph nodes, there are also a variety of lymphocytes, a particular type of white blood cells that are able to destroy pathogens. So pathogens are anything that can cause you harm. So things like bacteria or virus or fungal cells or even small parasites can be killed by the lymphocytes present in the lymph nodes. Also in the lymph nodes, we have another type of white blood cell known as a macrophage, and this is a phagocytic cell, a cell that can engulf and swallow and digest either damaged cells or even just bits of cell debris that's floating around in the lymph. So lymph nodes are both protective and kind of a cleanup center for the lymph, so that when it re-enters the bloodstream as plasma, it has been filtered and cleaned, and the content of any pathogens has been greatly reduced. This happens because the lymph node itself is set up as an arrangement of chambers and channels where there's more ways into a lymph node than there are ways out. So in this one, we see we've got several ways that fluid can come into this lymph node, but really only one way out. And so as the lymph is traveling around the various chambers, there's plenty of time, it's slowed down, and there's time for the white blood cells to do their job. Here's a diagram that's just showing, again, many ways into a lymph node, but only one way out. And within the lymph node in these various chambers, we have various lymphocytes, and the lymph has been slowed down so that there's plenty of time for the lymphocytes to act on the pathogens and destroy them. Lymph nodes are found in several major areas of your body. Cervical refers to around your neck. Axillary is around your armpit. Inguinal is the groin. So these are all places that are close to the extremities, the parts of your body that stick out from your torso. Cervical would be, of course, from the head, axillary from the arms, inguinal from the legs. And so they are situated sort of as gatekeepers to protect against invasion that may be coming in from the extremities. You get a cut on your arm and some bacteria move into your body from your arm. They'll be caught in the lymph nodes in your armpit area because the lymph will pass through that on the way into the torso. Along with the lymph nodes, which are fairly large, again, about the size of a kidney bean, there are also smaller structures known as nodules, and the nodules are found in all mucous membranes that are lining our body. So the mucous membranes line the gastrointestinal tract, they line our respiratory tract, reproductive tract, and the urinary tracts. Basically, all the parts of the body that have an opening to the outside are lined with mucous membranes, the epithelial cells that produce mucus that can help trap pathogens, and then, of course, the nodules are there to destroy the pathogens that have been trapped. If you have an upper respiratory infection and the doctor checks the lymph nodes on the side of your jaw, if they are swollen, This indicates that there's been immune activity in that area because the number of white blood cells has multiplied. The number of lymphocytes present in those lymph nodes has greatly increased so that they can deal with the infectious agent, be it a virus or a bacteria, which then causes those lymph nodes to get more swollen. And that's what you can actually then, they become easier to feel. They're hard and inflamed, and often they're also sore. But it's just an indication that your body is fighting off something and your lymph node is doing what it is supposed to be doing. There are several organs that are also part of the lymphatic system. The spleen is really the major organ, and its job is to filter the plasma. So it's doing the same kind of filtering thing that our lymph nodes are doing, but it's working on the fluid that stayed in the bloodstream. So the spleen, like the lymph nodes, is set up with many small chambers on the inside with lymphocytes present and macrophages present. And so as the blood moves through the spleen, the plasma is filtered there, where pathogens are identified and removed, and also any red blood cells that have really become too old. They get stiff as they get older, and they're not able to go through the capillaries as well. And so then they are removed, and parts are recycled and other parts are destroyed. Along with the lymphocytes that are involved in pathogen removal directly in the spleen, we also have B cells in the spleen, which are the particular type of lymphocytes that produce antibodies once they've been activated against a particular pathogen. And also platelets are often found, and they're an important part of the spleen, has an important job in storing and activating platelets. It is possible to live without a spleen because other organs can take over the function if your spleen is removed. It's rather fragile, and a car accident may cause damage that cannot be repaired. And so if you no longer have a spleen, your liver and your red bone marrow, I made a little typo there, red bone marrow and lymph nodes can take over the job, but you do lose some of the filtering and protection. You're a little more susceptible to infection if you don't have a spleen. And then the other major organ is the thymus, which we did talk about briefly when we were talking about the endocrine system, because it makes thymosin, a particular hormone. The thymus is the place where certain types of lymphocyte, the T lymphocytes, are matured. Lymphocytes, again, are a type of white blood cell. All blood cells are first made in the bone marrow. Some of the white blood cells go on to mature in the bone marrow. They're called B cells. Other white blood cells go to the thymus to mature, and they're T cells. Particularly, we have just sort of ordinary T cells, and then ones known as helper T cells. We'll hear more about those in the next video. The thymus is very active in childhood and adolescence. It's about 10 times the size it is as compared to somebody in their later years in adulthood, but it shrinks over time and becomes less active. So it does most of its work in creating those T cells early on in your life, and then it just has a very small role to play in maintaining those particular immune cells. I want to mention tonsils because you may be familiar with them. They are not an organ. It's just one of the lymph nodes, or actually they're lymph nodules because they're in the mucous membrane in the back of the pharynx, part of your digestive and respiratory system. And basically we have them in 3 different places. The palatine tonsils are the ones that are found either side of the mouth. So this diagram over here on the right showing somebody has rather enlarged palatine tonsils, having tonsillitis. The adenoid tonsils are on the roof of the mouth, so that's probably what's contributing to this kind of enlarged uvula on this diagram. And the linguinal tonsils are on the back of the tongue, so that may also be why it's looking a little more swollen here on either sides of the tongue. These tonsils actually are providing a ring of protection around the pharynx against any pathogen that may be entering from your mouth or through your nose, since both of those openings go through the pharynx. The pharynx, remember, is your throat. And so again, if some bacteria has passed through and gets picked up by these lymph nodules, they will reproduce. The number of white blood cells in them will reproduce. They'll become swollen and inflamed because you're fighting off the infection. But then that causes a sore throat, difficulty swallowing. And in the past, if a child had numerous times of tonsillitis because they were having upper respiratory infections, doctors would often remove them. Nowadays, doctors are not quite so quick to remove the tonsils because if you're able to withstand those multiple infections, you actually are keeping some of your immune system present that you lose if you have those tonsils removed. So it's just, again, it's a lymph nodule, part of your lymphatic system, part of that working with your immune system to keep you safe from harm. And then finally, I just want to talk a minute about cancer, because when cancer spreads, when it metastasizes, this means cells have broken off from the original tumor, and so they're moving around the body, and they will be, because the tumors are located in body tissues, the cells will be in the interstitial fluid area and will be picked up by the lymph system and will be, present then in the blood and the lymphatic system. The lymph nodes, which are closest to the cancer site, will be contaminated first because they'll be the first ones that these cells that have broken off, metastasizing cells, that's where they will end up. And so often when somebody has a tumor or has been diagnosed with cancer, the lymph nodes will be evaluated for the presence of cancer cells, because that will be an indication that this cancer is metastasizing. It is moving beyond the original tumor if those cancer cells are showing up in the lymph nodes. So that's why doctors will remove the axillary lymph nodes for someone that has breast cancer to evaluate them for the presence of those cancer cells. But because you're going to change the lymphatic system, somebody who's had those lymph nodes removed may experience some edema, some interstitial fluid collecting in this part of the body just because you no longer have the pathways to remove the lymph the way they used to be present. So finally, just a few questions for you to check your own understanding and go back and review if you're not quite sure. Can you distinguish between plasma, interstitial fluid, and lymph? What do those three words mean? Can you trace the pathway of lymph vessels? Where do they start? Where do they end? Can you identify those major locations of lymph nodes or lymph nodules and discuss their function? And can you describe the role of the spleen and the thymus in the lymphatic system? Why are those organs part of the lymphatic system? So this finishes my overview of the lymphatic system. The next video, we'll talk a little bit more about the immune system cells in detail.